All right, let's talk about endocrine disorders. These things are so tricky, right? They can silently disrupt pretty much every single system in the body. And when it comes to your exams, knowing the difference between them is absolutely critical. So we're going to take a peek at a framework that's designed to help you really master these complex conditions. And this right here is exactly why getting this stuff right is totally non-negotiable. I mean, the stakes are just incredibly high. A simple misunderstanding isn't just about losing a point on an exam. No way. In the real world, it can literally change a patient's outcome in a matter of minutes. Let's be honest, we've all been there. You memorize the hormones, you memorize the glands, but then you get hit with a question about vital signs or lab values, and suddenly it feels like a whole different puzzle. The key isn't just knowing what the hormone is, but really understanding what it does to the body when there's way too much or not nearly enough. So check this out. Here's a really powerful way to simplify everything. Instead of trying to memorize dozens and dozens of disconnected symptoms, what if we just organize them into simple, logical opposites? All you gotta do is ask yourself one question. Is the body dealing with an excess of a hormone or a deficiency? Seriously, that one question can unlock so much. Okay, let's see how this works with the adrenal hormones. In Addison's disease, you've got a deficiency. The body is running low. So what do you see? Things like hypotension and that unintended weight loss. But with Cushing's, you have an excess of cortisol. The body is in total overdrive. The result? The exact opposite. Hypertension and weight gain. You see that pattern? And guess what? The same pattern holds true for the thyroid. Hypothyroidism is a deficiency, so it causes a decreased metabolism. Everything just slows down. On the flip side, hyperthyroidism is an excess, and it puts the body into this dangerous hypermetabolic state where everything speeds up. It's literally low and slow versus high and fast. Okay, time for a little pop quiz. You see these three classic signs pop up on an exam. Based on the pattern we just talked about, are these symptoms of too much hormone or too little? What's your clinical intuition telling you? If you were thinking excess, you absolutely nailed it. That weight gain, the moon face, the high blood sugar, they all point directly to a cortisol excess, which is Cushing's disease. See? The pattern holds. This right here is the kind of clinical reasoning that makes all the difference. Okay, so we've got the opposites pattern down. Awesome. Next up, let's tackle another area where exams just love to try and trip us up. How these imbalances throw off the body's fluid and electrolyte balance. This is where it gets really interesting. So here's another classic scenario. Your patient has low sodium, hyponatremia, which is always a huge red flag. But when you pair it with fluid overload, meaning the body is holding on to way too much water, that points to a very specific problem. Which one do you think it is? And this is where so many students get tripped up. See, both SIADH and Addison's can cause low sodium. So the crucial point, the thing you have to look for, is the fluid status. In SIADH, the body retains too much water, which dilutes the sodium and causes that fluid overload. But in Addison's, the body is losing salt and water, leading to hypotension and dehydration, not overload. That is a critical distinction. And it all comes back to this. Hormones like ADH and aldosterone are basically in a constant conversation with the kidneys, telling them how much water and sodium to keep or let go of. So when a hormone is out of balance, the kidneys get the wrong message, and that's when you see these really dangerous fluid and electrolyte shifts. Okay, we've covered the patterns, we've looked at the puzzle pieces. Now let's get into the highest stakes scenarios of all, spotting an endocrine crisis. This is such a fundamental concept. A patient might live with an endocrine disorder for years, but certain triggers like stress, an infection, or even missing their medication can push them right over the edge into an acute crisis. Your job is to see it coming. This is all about making those connections instantly. You don't just learn about Addison's. You learn to anticipate an adrenal crisis. You don't just study hypothyroidism. You're on the lookout for a myxedema coma. This is that direct line from a chronic, manageable state to a full-blown emergency. So let's put it all together in one last scenario. You have a patient with a known adrenal insufficiency. They've missed their steroid doses. Now they're suddenly hypotensive and confused. What is happening? This is a textbook setup for an adrenal crisis, and recognizing it immediately is what saves lives. So how do you pull all of this together when you're under pressure? Well, it's not about memorizing more facts. It's about having a simple, reliable framework that you can apply to any situation.
And here it is. This is the core principle. First, you recognize the core imbalance. Is it excess or deficiency? Second, you interpret what that imbalance is doing to the body's systems, the vitals, the fluids, the labs. And third, based on that interpretation, you prioritize your life-saving interventions.
And this is the result. You start seeing the story behind the numbers on the monitor. You can connect a lab value directly to what you're seeing at the bedside, and most importantly, you know how to act decisively when a crisis hits. Look, you can read about these diseases in any textbook, but this approach is about something different. We train your brain to think differently, to see the patterns, to anticipate the risks, and to understand the full body impact of a single hormone being out of balance. It's all about proactive, critical thinking. And that's why this all matters. Whether you're answering a question on the NCLEX or you're standing at a patient's bedside, the ability to interpret these complex signs quickly and accurately is the single most important skill you can have. This was just a glimpse into a whole new way of thinking about endocrine disorders. The complete, in-depth framework that puts all of this into practice is waiting for you inside.